Confused about what's actually going on in an adult ADHD brain? Today, I'm talking about what's different about ADHD when we see it in an adult and a case to help explain the differences and potential other causes. Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. So I'm going to start today by introducing Emily. She's a 38-year-old marketing professional who lives in a busy urban area. She was diagnosed with ADHD, attention deficit hyperactivity disorder, predominantly inattentive presentation, in her early 30s. Even though she didn't get diagnosed as a kid, during the evaluation, she was able to describe the symptoms in situations that made meeting the diagnostic criteria back then easy. Even though she's super smart and creative, Emily has faced tons of challenges in her personal and professional life due to her ADHD symptoms. Currently, ADHD is categorized in the DSM-5 as a neurodevelopmental disorder. To receive the diagnosis as an adult, someone would need to have 5 or more symptoms for more than 6 months, and symptoms had to exist prior to 12 years old. These symptoms have to cause serious issues with functioning in at least 2 settings. For kids, they need 6 or more symptoms, but the other criteria are the same. Let's start with inattentive symptoms that may be common in adults, pulled from the DSM-5 inattentive type. Loses or misplaces items needed to complete activities or tasks, sidetracked by external or unimportant stimuli, forgets daily activities, diminished attention span, fails to focus on details or makes thoughtless mistakes in assignments. And there are enough inattentive criteria that someone could meet the diagnosis without having symptoms in the other domains of hyperactivity and impulsivity. In Emily's case, let's check out her work situation. She's currently a marketing manager for a mid-sized tech company. She has to manage multiple projects and coordinate with various teams and meet strict deadlines. While she's awesome at creative brainstorming sessions and developing innovative marketing strategies, she really struggles with organizing and prioritizing her different work tasks. Her desk is often cluttered with papers and sticky notes, and she has trouble finding important documents when she needs them. The inattentive problems that cause Emily the most trouble include missing details in emails and reports, which leads to making mistakes that have to be fixed. Emily's also disorganized, and she has trouble keeping track of details and feels overwhelmed by the amount of work that she has. She's always rushing around last minute to try to get things done, which sometimes shows in the quality of her work. And she's no stranger to procrastination either. She definitely avoids starting any tasks that will require long periods of mental energy, like writing reports or analyzing data, which creates more stress. There are some theories stating that the main problem with ADHD comes from impaired regulation of the arousal or activation state. There are deficits in sustained attention, and an ADHD brain will often try to improve that mental activation by sensation seeking and hyperactivity. Let's get into hyperactive symptoms. Fidgeting with feet or hands. Marked restlessness that is difficult to control. Overly talkative. And here are a few common adult impulsive symptoms. Interrupts or intrudes into conversations. Impulsively blurting out answers before questions are completed. So what about at home? Emily is a mom of 2, and her partner also works full-time. At home, she's in charge of groceries, meal planning, and kids' schedules. No matter what, it seems she's always playing catch-up. She forgets appointments, school events, and even some kid activities. She has to scramble at the last minute to try to get people where they need to go and does a lot of rescheduling. Her time management skills are not great, and Emily will usually underestimate the amount of time it will take her to get something done, especially for chores or running errands, like grocery shopping. She and the family almost always feel rushed, and when she's shopping, she often makes impulse purchases or says yes to things that sound fun without checking the schedule first, which adds more stress to the calendar and finances. There's another theory that thinks maybe ADHD is caused by impaired bottom-up limbic regulation and problems with reward-related processing. But this is just a theory, and we're not really sure yet. Okay, so how does ADHD look different in kids than adults? Some of the most common symptoms that we think of in kids have to do with hyperactivity and impulsivity, which often seem to decrease as kids become grown-ups. But these symptoms actually still exist. They just tend to look more like internal restlessness or tension, and this is often attributed to anxiety, which can be really tricky to parse out. Emily didn't really have a lot of these symptoms, but she's pretty fidgety in meetings and spends a lot of time pacing in her office when she's on calls. The environments we find ourselves in as grown-ups also have different rules or behavioral constraints. So it may not be inappropriate to get out of your seat and walk around your office when that's not okay in a second grade classroom. But many adults with ADHD still struggle with thinking before acting or behavioral inhibition, like cutting people off in conversation or making big unplanned purchases. Attention problems are most likely to stick around, and we can see a lot of this in Emily's case. Can someone consistently, continuously do the thing they're supposed to do? They may vary in how much energy or alertness they can maintain in a certain task. In ADHD, errors of omission, leaving things out or missing them completely, is also a really common symptom of inattention. What about impulsivity? In adults struggling with ADHD, we see higher urgency and sensation seeking, but lower planning and perseverance. And the memory problems that people often complain about? If ADHD is playing a part, it appears that the problem isn't with retrieving the memory, it's with not creating or encoding it in the first place. Although anyone can go through a chaotic time at any stage of life, many kids have a more consistent environment with a parent and school and routines. In adults, there can be a broad variability in symptoms depending on the stage of life they're in, and especially at transition points. Losing a partner or a job can have a huge impact on support or routine, or just a lot of stress, and can lead to more pronounced symptoms. For a true ADHD diagnosis by DSM-5 criteria, the symptoms must have shown up before 12 years old. But we know that these criteria were designed for kids and not adults. And for many older adults, the diagnosis of ADHD didn't even exist when they were 12 years old. So here are some stats. The current prevalence of ADHD in adults is somewhere between 2% and 5%, and up to 60% of cases have persisted from childhood. And here's a sad but telling statistic. 26% of the incarcerated population is diagnosed with ADHD, which continues to impact them in a negative way. ADHD is a lifelong disorder for most people who have it. It may be seen even more in those over the age of 60 because of lack of diagnosis in the past. But 95% of the late onset cases are excluded after addressing comorbid mental health and substance issues. So what else could be going on? What if Emily was also feeling low interest and motivation, forgetting things all the time, and spending too much time in bed? What if she's actually depressed? If her ADHD symptoms just showed up, then we have to look for other causes of inattention or impulsivity. Let's start with the mental health differential, which includes anxiety, depression, bipolar disorder, PTSD, personality disorders, and substance use disorders. There's a ton of overlap in these conditions, with trouble concentrating, staying alert and engaged, procrastinating, or not being motivated and interested. And depending on how people describe symptoms or how their provider interprets them, can lead to a misdiagnosis very easily. What about the medical differential? What if Emily was also having hot flashes and irregular periods? Or she was losing her hair, hot all the time, and having trouble sleeping? Maybe perimenopause or hyperthyroid? Here's a list of a few conditions that may look like ADHD in some people. Thyroid or other hormonal imbalances, a B12 deficiency, OSA, obstructive sleep apnea, infections like HSV or herpes simplex virus, or even syphilis. Neurological conditions like tumors, TBI, stroke, or disorders like Alzheimer's disease, and even side effects from medications or polypharmacy, or even being hearing or vision impaired. We definitely don't want to misdiagnose. But even more than that, we don't want to miss one of these conditions because stimulants will not treat your hyperthyroid. Stimulants are the gold standard for treating ADHD, although they're not the only effective treatment. And we don't want to get the diagnosis wrong because it won't really help and is much more likely to cause side effects and waste time and money. As an aside, stimulants are controlled substances, and there are currently a lot of limitations when prescribing them. As of this recording, it may not even be possible to get stimulants without seeing a provider in person. This is due to the Ryan-Haidt Act, which I'll link to in the description. So let's finish up with Emily. She's been working on her skills with her therapist before she decides if she wants to try medications. Right now, she uses her phone for task lists, syncing calendars and schedules, and sets a lot of alarms and reminders for appointments and deadlines. She's trying to structure her daily routine to help her with time management and family activities. She's set aside specific blocks of time to do chores and finish work, and she has little rewards that make it seem easier to get started. She also goes to almost all of her therapy appointments and has a monthly ADHD support group where she learns new tips to try and feels connected with people that really understand her situation. And there you have it, a run-through of the most common differences seen in adult ADHD and a case showing it in real life, even though it's a fake case. Hope your brain is full of attentional goodness, no alarms or reminders required. Grab more tasty tidbits at brainbiteswithdrb.com. Enjoy!